Hi everyone, welcome to another episode of Doctors Explaining the latest in the technology. And today I have Dr. Stacy and myself with you guys. Together we have been working in the field of regeneration, and we both have PhDs in functional medicine, integrative medicine. So I would love for Dr. Stacy to cover something exciting in the field, something you may or may not have heard about. We like to cover about the GlowStack. So GlowStack is something that's trending in the world of peptide therapy, and we have some differing opinions when it comes to GlowStack, and we actually have our own protocol when it comes to it on something that is much more safer, non-invasive, that can get you actual results. So with that being said, Dr. Stacey, go ahead and introduce, give us some background info on what is GHK, what are the GlowStacks, and the specific protocols that we use here as doctors.
Absolutely. Thanks, Dr. Bell. So peptides are all the craze right now. If you go on Instagram or Facebook or TikTok, everybody's talking about peptides, injecting peptides, all the websites you can order the peptides from. And it's kind of scary, honestly, because you're talking about injecting something into your body that you don't really know where it's coming from. You don't really know where you're getting it. What's it cut with? What's inside of it? What's the effectiveness of it? And is it really safe? Am I really going to get the results from it? And how much money am I going to shell out in the process? And not to mention you're using a needle. So you're literally entering the body with a needle, with a foreign substance. So yes, there gets to be some kind of controversy around that. Like, is this even safe? And so when we look at the technology that Dr. Mel and I work with, it is a non-transdermal patch, okay? And so this patch has nothing in it. I say non-transdermal because that means nothing transfers into my body through my skin when I put the patch on. This is a wearable light technology. And so this is activated by my body's heat or light that I'm emitting. It's dark outside right now where I live. And so I can't go outside and see my neighbors or animals unless I'm looking through night vision goggles. I can see the heat or light that's being emitted from the body. That is what activates this patch. When I put the patch on, a wavelength of light is reflected into my body, and that is going to elevate a specific peptide. And so we're going to talk about 3 specific peptides tonight. And we're going to, the GlowStack, as Dr. Mel mentioned, and we're going to talk about that in reference to what patches we use instead of injecting some synthetic substance into our body. And again, the thing I caution you on is unless you're being seen by a medical doctor that is prescribing these injectables, that has you on a schedule of when to use them, when not to use them, what amount to use and what amount not to use, I caution you because it could get pretty tricky and honestly scary when you are injecting things into your body, if you're not educated and knowledgeable. And I don't mean TikTok educated. I mean actually like doctor, medical educated. It's a substance, right? And it does say on most of these peptide sites that this is for animal use only. So with that, our patch, again, is not putting anything into the body, but guess what? We have these peptides in our body. Our body can do these things itself. It's just declined because we've aged, or maybe environmental factors, stressors. The stress out there in the world is pretty crazy today. It could be that there are other types of toxins that you've been exposed to that have caused your peptides to not function correctly. But again, age is the most common factor for people, and that's where we tend to see most people, using peptides when they get older for metabolic reset, for hormone therapy types of things. And so, of course, the GLPs are crazy, right? That's just insane, the GLPs and what's happening out there with those. But know that using this patch technology is going to elevate your own peptides, your own body's ability to get into balance. So I'm going to screen share. I have just a real basic document here, but this is something that is going to help you to understand how peptides work and what peptides you can use instead of injecting. So the GlowStack is GHKCU, copper peptide, the BPC 157, and the TB 500, okay? So when I look at GHK, which is right here, this is the actual injection peptide, okay? And this is what it's thought to do, right? It's a peptide that your body, it declines in your body as you age. By the time you're in your 60s, you have less than 20% of this peptide even active. You can inject it. There are over 13 pages of research of benefits of injecting GHK. And that's been done. Dr. Lauren Bacard discovered this peptide in the body over 50 years ago. So it has massive benefits by keeping this peptide elevated. Collagen production, wound healing, tissue repair, skin rejuvenation. It can influence stem cell related pathways and gene expression for repair. But when we look at the X39, the patch that I have on right now, that is not an injectable. This patch took 10 years for David Schmidt to develop, to figure out, working at the Stem Cell Institute in Ireland. 10 years, over 70 patents he obtained to try to figure out how to elevate GHKCU copper peptide with light. And so those 70 patents he obtained, of course, we have a patent on this technology. You will only find this through Dr. Mel, right? Because we are working with LifeWave. And so using this technology, this is shown to be a patch that 100%, again, our patent states, we elevate GHK in the blood. We reset over 4,000 genes in the body instantly back to their young, healthy, youthful state. And we elevate and activate our own stem cells. So not only is this patch going to support the things that were mentioned by injecting, but also we have a patch that you can use every single day. You don't cycle off. You don't worry about any contraindications or any interactions with medications or other peptides because you're elevating your own GHK. And so that is going to work over time, compounding. We can see with our surgeons, they will cut the healing time after surgery in their patients 40 to 50%. We can see those changes in collagen production around that 90-day mark with the skin. It goes deeper than that. Our clinical studies, we get into looking at the brain and the heart and how things are repairing the kidneys, the liver, the lungs. So get with Mel. She can definitely show you those clinical studies and be able to give you more of a deeper look into GHKCU. And again, we're elevating it with our own patch, our own GHK with a wavelength of light. Now, when you look at BPC 157, it's an incredible peptide. It honestly is. And I'm not saying we're going to elevate BPC. I'm going to talk to you about that here in a second. But BPC is very different than GHK. And that's going to look at the gut health. It's going to look at the tendon and ligament repair and local tissue healing. People will inject it into a certain area. The problem is sometimes those areas are super hard or tender to get to. I've had a man try to inject into his ankle and said there's no way he was putting a needle into his ankle. It was so painful. But knowing, again, you can put on a patch and create that same type of stress reduction of inflammation to help support the body's healing in conjunction with the X39. Again, doesn't matter where your pain is. It doesn't matter where the ligament or the tendon is. You don't inject into it. You put a patch on it. So knowing that BPC is popular and it is effective, we don't know that long-term use. And we don't know what the possible side effects could be and interactions with the other peptides. But knowing using Eon, which is a patch that's going to elevate your own angioplasms, which are the body's SOD, right? Your own SOD, superoxide dismutase, the body's own anti-inflammatory components. We're going to elevate the peptides that do that. So using X39 and Eon in conjunction is what we would use instead of injecting GHK and the BPC. That's going to support the nervous system regulation, and that's going to support the reduction of inflammation systemically throughout the whole body. Because remember, we don't have to put a patch on a certain location in order for it to work. We know that these peptides are being elevated throughout the entire body, and that's creating a systemic effect. And then finally, I want to talk to you about TB500, which again, muscle recovery, performance, soft tissue repair, great peptide. But again, you're injecting this on a consistent basis until you have to, cycle out of it. But when you look at the X39, X49 combo, so using X49 is designed to elevate AHK. It's a different patch. It elevates a daughter peptide to the GHK. AHK is for alanine, GHK is for glycine. So elevating AHK, we see improvements in strength, in stamina, in reduction of body fat, in increase of bone density. We can see in looking at the fitness, the composition of the body, the exercise, we can see improved stamina, we can see improved pulse rate being consistent and in that endurance over time, and a much faster recovery. So people say, I don't even need a day down time. I'm ready to go again. I couldn't believe I ran 3 miles and I feel amazing. I'm normally down for days if I do that. And no matter what your activity or fitness level looks like, X49 is going to be the replacement for the TB500. Using that in conjunction with X39, we call that the performance bundle. Again, mother-daughter peptides work very well together. So then finally, when we look at chronic stress and the sympathetic nervous system being in overdrive and inflammatory processes happen in the body, we love to use the X39, Eon, and X49 instead of the GlowStack, because we know that these are patches you can use every single day, and they're elevating your own peptides to help reduce the stress, to help bring the body into balance, to help control that cortisol, to be able to bring you into a calm state, a nervous system state, to reduce inflammation, to help support the recovery and the improvement in the functionality of your entire body, but in specifically those 3 peptides in that GlowStack. So I know that, there's a little bit of information there. I'm not a medical doctor, so please, if you have questions, please check with your medical doctor in regards, but know that Dr. Mel and I have worked together now for over 4 years, and we have definitely worked with the people in the area of regenerative integrative functional medicine and helping them to use this technology safely without any worries, any risks, or any complications or contraindications. So thank you to Dr. Mel for having me on here today and explaining more about this technology.
Yeah, of course. Well, I kind of explained to them how they can get in touch with me. Do you have any pictures of before and after that you can share with our audience so they can kind of see the difference of someone using the patches and then 3 months later how they look physically, if you have it handy? If not, it's okay too. We can do it next time.
Okay, you tell them how to get it, and I will see if
absolutely.
I can grab.
So below this video, there's gonna be a cell phone number. Go ahead and text the word patch to that cell phone number, and what we'll do is we'll get in touch with you and see if you'd like to connect over text and have us send you our recommendation over text, or we can even schedule a 15-minute consult over the phone and basically customize a protocol based on your wellness goals, because everybody has different needs. One size doesn't necessarily fit all, and I would love for us to be able to support you whatever your goal may be. Let me know. If you haven't found it yet, I can share the story of this company.
Okay, so I did find something I wanted to share with you.
Awesome, thank you.
Let me do this real quick. It's not an actual person. I have lots of people. I would just have to go through my camera roll to find those right now. But this is actually a PowerPoint that David did at one of our events, the NOVA event, talking about using the X39, X49. And he talked about the benefits with the patches, improvements after 2-month period of time in sit-ups, push-ups, squats, bicep curl, and grip strength, which is huge. It's a huge indicator of longevity. And he also, of course, went into using it in conjunction with X39, 49, that combo. And you can see the difference in the calories burned and the top speed, the distance, and the pulse rate that I was mentioning earlier, that endurance that people are experiencing in that calm nervous system through it. And so there are some changes that they noticed with as I mentioned, the fat loss, 11% in 60 days, and increasing lean muscle mass. So this is a a man, a 74-year-old male, before his body fat was 37.55%. With a fat mass of 66 pounds, right? Huge health risk right now. And then you can see after his body fat went down to 33, and then his fat mass was down to 59 with a 20% risk. So he almost more than cut his risk in half.
Wow.
Just from, and this is a scan that was done of the man, and you can see, front and side view versus front and side view. But seeing that fat mass change and that health risk change was huge in a 60-day period of time. Okay.
That is huge. Amazing.
Yeah, that's something that David had shared at our event. But we do have lots of before and after pictures, so we can definitely show those with you, because we have a lot of people that have used this technology in my 5 years using the technology, and so we have lots of befores and afters. Actually, one hit my timeline today, so it was kind of interesting to see that before and after picture of myself and my memories. I was like, oh wow.
Wow,
it's changed.
Amazing. And before we go, do you mind sharing just a quick story of how it all started, how this technology came about?
Absolutely. So David Schmidt's an inventor. As I mentioned, he's the inventor of this tech, but he's an inventor his entire life. He's 63 years old. And he was contracted, his company was, by the U.S. Department of Defense with the Navy SEALs to invent survival equipment for a mini submission they were on. And things were going great. Everything was amazing. But the SEALs were having a problem with sustainability. They were up all night, caffeine, amphetamines, the whole 9 yards. They'll do whatever it takes to keep them up. So David invented a patch called the Energy Enhancer. Do you have yours on right now? I know you
it is again on my belly. Sorry. I have found a new location, so I've been putting it on my belly, and it's doing some cool stuff. But yeah, I usually wear it here, white on the right, tan on the left.
Yes. So Energy Enhancer patches work to trigger beta oxidation. They turn body fat into fuel. So instead of using a stimulant, you use the Energy Enhancer patches. That helps increase the mitochondria at the cellular level, that ATP, right, the energy output. So David invented these for the SEALs. Things were going great. Well, then 9/11 happened. Nobody knew that was going to happen. So the Department of Defense pulled out. Obviously, that Navy submission was canceled. So David started working with Richard Quick, who was a 6-time USA Olympic swim coach. His gold medalist athletes, swimmers, started using the patches. 6 out of 8 beat their PR like that first time out. A PR, a gold medal record, like you have a gold medal for this time, and now you just put on these patches and you beat that time. Wow. So of course, we have our anti-doping US or anti-doping world letters, because these have been used all over the Olympics, and you have to prove that there's nothing going to the body, no stimulants, no enhancements, nothing. As I mentioned, non-transdermal patch, we have those to share with you if you're interested. But what happened from there was 2 years of clinical studies at Stanford University, proving that what David had, what he invented, was correct and was doing what he said it was doing. So after that, he started LifeWave, which was 21 years ago. So over the last 21 years, he's invented a dozen different patches. And as I mentioned, with the X39 taking 10 years in the lab to figure out which wavelength of light would elevate GHK when applied. This patch is 6 years old now, and we do have a 20-year patent on it. So know that you can only get it through us, and this is something that is definitely mind-blowing, what it's done for people and what is still to come in the future with LifeWave.
Wow. Thank you so much for your time tonight, and thanks everyone for watching this video, and we hope to connect with you all soon. Bye for now.
Bye.